Hello everyone, it's me, Mr. Sivraj Lamsal speaking here, and today my topic is how to overcome stuttering. Uh, in this topic, I'm going to tell some methods to overcome stutter, which can help a person who has the stuttering habits. So first is fluency shaping therapy. It is the modern approach. In this approach, there are different methods like it helps to it in this technique you have to use the techniques like the prolonged speech, or you can say prolongation means we have to uh, prolong the initial letter of the word. We have to prolong the initial letter of the word, which helps if we begin to block, if we have the stuttering blockage problem in any word. In such word we can use the prolongation. We have to prolong that initial letter, and if we use the prolongation technique, it helps us to overcome stutter. Another is gentle onset or easy onset. We have to we have to make it our habit to start with a gentle onset or easy onset. Try to make our articulatory organs as natural as easy. We can do this by watching in front of a mirror, or we can even record our video, and we can look how is our articulatory organs, how we are expressing, how is the how we are moving our mouth or lips or tongue. We can see it, and we have to use the gentle onset or easy onset. Another is the control breathing. We have to control our breath, because the breathing, if we can control our breathing, we can control our speech. So if our breathing is very normal, long and deep breathing, at that time it becomes easy to speak. But when we are very nervous, very tense, very anxious, at that time we begin to speak very faster, and at that time we begin to stutter. So in the same way, other another techniques for overcoming the stutter is stuttering modification therapy. So stuttering modification therapy, what it suggests us, its main aims is to reduce our fear and struggle around the stuttering rather than eliminating stuttering. uh, we cannot eliminate the stuttering so fast because it is a long habit. From so many people are stuttering from their childhood, so we cannot fix a stutter so fastly, so quickly. So but we can do, we can reduce the fear and struggle around the stuttering behavior. In the same way, another is inquiries. The inquiries is managing stutters with the techniques like the cancellation, pull outs, and preparatory sets. We have to encourage managing stutter with the techniques like the cancellation. So when we begin to stutter, at the time we have to stop. We should cancel the word and pause and again inhale and exhale. With exhale we have to speak, or we can use the pull out techniques. And preparatory sets means, if we imagine, if we have anticipated any words in which I will stutter, so we have to already be aware in, if there is any word in which I feel I will stutter, so we have to do preparatory sets. We can use the prolongation or airflow techniques. And another is emphasis on the CBT strategies, or cognitive behavioral strategies, to address the anxiety and the negative thoughts related to stuttering. We have to use the CBT techniques. So it deals about our thoughts, our emotion, our feelings, our behavior. So what do we think about our problem, our stuttering? Another is how we feel, how is our emotion about the stutter, and what type of behavior we show every day. So this, our thoughts, our emotion, our behavior takes a greater role in overcoming stutter. If our thought is very positive, then our emotion, our feeling will also become very positive. In the same way, if our behavior is going outside, meeting peoples and doing more socializing, then we can reduce our fear. In the same way, helps the reduce social anxiety avoidance behavior. We should not avoid any speaking situation. We have to face any speaking situation. How much fear comes, but we need to face it. So exposure is very essential in the social anxiety. So we should not avoid any speaking situation. We have to always face the speaking situation, and we should have the positive self-image. We should always have positive self-image. I can do it. It is very easy for me to do. Even if I stutter, I can again try my best. So I have to face any speaking situation, and can be done with the speech therapist or the psychologist. If you want to remove your stuttering using the CBT tools, you can visit any psychologist or speech therapist. Speech therapist and the psychologist can help you. Another therapy is called acceptance and commitment therapy. Acceptance means you have problem, stuttering problem. So many people have this problem. uh, 1 in 100 people stutters. 1 in 100 people stutter. So you are not alone. So you have to accept your problem as it is. And another thing is, you have to do the regular practice to remove the stuttering. Accept yourself, you stutter, and you have to do practice what your speech therapist say, what your psychologist say. You have to do that commitment. Focus on accepting stuttering without struggling against it. Another is encourage to commit to meaningful communication despite stuttering. Encourage the stutter to commit to meaningful communication despite the stuttering. Another is help improve the qualities of life and reduce anxiety. So CBT can help us to improve the quality of life. So this type of thing. Another is mindful and relaxation techniques. We should do the mindful meditation and relaxation techniques we have to use. And for the pharmacological approach is also there. Some people with stuttering, they the psychiatrist can give them some medicine, and which can also help to overcome their social anxiety. And because of reducing social anxiety, they can manage their stutter also. So thank you very much for watching my videos. Please give your feedback after watching this, and thank you very much for watching once again.